Hello, my name is Dr. Grace Perez, and I work with Dr. David Siegel at the California Institute of Regenerative Medicine. Currently, we are conducting research on a genetic disorder called Angelman syndrome. Now, where is Angelman syndrome found and how does it occur? Angelman syndrome is found on chromosome 15. The name of this gene is UBE3A. This disorder occurs when there is a mutation to the gene and it is not an inherited genetic problem. Typically, people inherit one copy of this gene from each of their parents. This disorder mainly attacks the nervous system. However, these copies can spread to other parts of the body as well. Now, let's talk about who discovered Angelman syndrome and when it was discovered. Angelman syndrome was first discovered in 1965 by an English physician named Dr. Harry Angelman. His observations were in 3 children. He noticed that they all had stiff, jerky gaits, absence of speech, and excessive laughter and seizures. However, due to the disorder being extremely rare, many other physicians doubted its existence. The earliest reports in North America didn't appear until the early 1980s. Now, what is the possibility of a population being affected by Angelman syndrome? Angelman syndrome occurs in 1 in 15,000 live births. However, due to its symptoms being similar to those of cerebral palsy and autism, this disorder was often and is still oftenly misdiagnosed. What are the symptoms of Angelman syndrome and what happens to people with this symptom as they age? Angelman syndrome is a genetic and neurological disorder. It is characterized by a severe delay in the development of learning. Other symptoms include the inability to speak and the inability to coordinate voluntary movements. This also results in jerky and tremulous movements of the arms and legs with a distinct behavioral pattern that looks like a happy disposition with spontaneous laughter and smiling. Some people with Angelman syndrome lean to communicate through gestures due to the lack of the ability to speak. Other symptoms include seizures, sleeping disorders, and difficulties of eating. Sometimes the symptoms of the disorder evolve with age. The hyperactiveness and poor sleeping patterns improve somewhat, and seizures get a little better as well. Is there a cure for Angelman syndrome? Currently, there is no cure for this disorder as it would require repairs of the chromosomes. However, there are some treatment options to assist in improving the lives with people with Angelman syndrome. Some of these treatment options include anticonvulsant medication to minimize or prevent seizures, and physical therapy to help with the mobility of the joints and movements. What are some experimental treatments and trials that can be helpful for these types of people? Currently, Hoffman La Roche is sponsoring clinical trials known as the Tangelo. There are 7 criteria that a patient must meet in order to participate in these clinical trials. The criteria includes the following. They must have a diagnosis of Angelman syndrome. They must be between 1 to 12 years old. They must have a stable medical status for 4 weeks prior to screening visits. They must be able to tolerate blood draws, and they must be able to undergo LP and IT injections under sedation or anesthesia 3 times during an 8-week period. What is the lifespan of people with this disorder? The majority of people with Angelman syndrome will have a normal lifespan. Over time, some other symptoms might improve with health skills and supportive care. Most people with Angelman syndrome will require a constant care and attention due to their behaviors. How is genetic engineering in stem cells used for Angelman syndrome? In 2021, David Siegel and Deborah Liu received the Discovery Stage Research Projects Award for the Governing Board of California Institute for Regenerative Medicine. This was established to promote the discovery of promising new stem cell based and gene therapy technologies that could be translated to enable broad use and ultimately improve patients' care. Although there is no current treatment for Angelman syndrome, Siegel and his team are researching AAV9 Cas13 gene therapy that will deliver a targetable RNA nucleus to the brain to safely and permanently restore expressions of UBE3A deficiency in the neurons of the central nervous system. Now, we're going to talk a little bit more about Professor David Siegel. Siegel has received $1.36 million to work on finding a treatment for Angelman syndrome, which is, again, a rare neurologic condition. This therapy will use a first-of-its-kind mechanism to bring much-needed new treatments that could directly benefit around 2,500 children and families living with Angelman syndrome in California and more globally. Siegel is also a member of the UC Davis Genome Center and a facility member at the UC Davis Mind Institute. He also holds joint appointments in the Department of Biochemistry and Molecular Medicine and Pharmacology. Hi, this is Dr. Grace Perez, and I hope you have found my presentation on Angelman syndrome enlightening, and you now have a better idea of the complexities and difficulties associated with this disorder. As you can see, living with Angelman syndrome is not easy for the person with the disorder or for the caregivers. In the old days, it must have been extremely difficult to live with such an unusual disease and not even be able to obtain an accurate diagnosis. However, with the help from current medical advances in genetics and proper diagnosis, families have better answers to be able to deal with this syndrome. Also, foundations such as the Angelman Syndrome Foundation and FAST provide a support system with a list of doctors, treatments, and trials, webinars, and online support groups.